Hi everyone. So to kind of go into this week's discussion on global health and nutrition, women's nutritional status is critical to improving maternal and newborn health and development in general. Undernutrition among pregnant women leads to increased risk of infection, anemia, lethargy, weakness, lower productivity, poor birth outcomes, maternal complication, and even death. So nutrition plays a critical role in all these adverse health outcomes and the things that can arise from it. In developing countries, every second pregnant woman is iron deficient, and anemia contributes to 20% of all maternal deaths worldwide. Poor nutrition in women in general, and pregnant women in particular, also contributes to newborn death and disability, resulting in some 800,000 deaths annually in the first month of life, or more than a quarter of all newborn deaths. Poor maternal nutrition increases risk for premature delivery, low birth weight, and birth defects. Undernutrition and overnutrition can result in obesity and gestational diabetes, or the onset of diabetes during pregnancy, which is associated with higher incidence of maternal and newborn health complications. Maternal obesity is also associated with higher risk of preeclampsia and the second leading cause of maternal death, which can also lead to newborn and infant death. So how do we address these issues? How do we improve them? How do we move it forward to start addressing these issues? So one way is to provide maternal and newborn nutrition education, counseling support, and promote exclusive breastfeeding. So I've kind of talked about exclusive breastfeeding in my past journal club discussion, as well as kind of done it in a research aspect for other discussion posts as well. And what I've kind of researched is that it is exclusive breastfeeding for the first 6 months of life, which means from infancy to 6 months. And even though the evidence clearly indicates the benefits of early initiation of breastfeeding for the first 6 months of life, only about 1 in 3 African babies are attributed to this. Additionally, providing women with agency, meaning giving them the opportunities, placing women at the center of decision making around food systems, dietary practices, and their own personal nutrition, can have an improved overall health. For example, the World Vision identified that at the household level in certain low and middle income countries, grandmothers have influence, but are rooted in traditional practices that are not always good for nutrition outcome. But there is influence that grandmother can have as far as nutrition for the mother and the child. To remedy this, the organization developed the Grandmother Inclusive Approach, which empowers grandmothers to champion of improved nutrition practices for infant and young children feeding practices, and to communicate that to the younger generation. Since the grandmother does have influence and a power dynamic within the community, instilling her and giving her agency to allow to disseminate that information has been shown to have impact, not just to educate, but also see improvement and implementation of that education in the community.